Good evening, audience. We will be starting the webinar in few minutes. Please wait online. Thank you for your cooperation.
Yeah, good evening, Mahesh. Good evening, Isha.
Good evening, sir.
Mahesh, Isha has joined. You can start the session. Shall we
Yes, sir.
start, Isha?
Yeah, that's perfectly fine. I can wait for people who are joining.
Yeah, it's live on YouTube also, so they'll be observing there. So I
see.
think Mahesh can introduce you and we'll start. Is it okay?
Yes, that's perfectly fine.
Your audio is bad. I can't hear you.
I did reply. Can you hear me now?
Hello?
Yes, can you hear me now? I can hear
Can you
sorry.
hear me, Isha?
I can hear your voice. Can you hear mine?
Yeah, but I am unable to hear your voice. Your picture is clear, but your voice is low. Can you increase your audio?
1 minute. Is this better now?
Hello?
Yes. Is this better now?
No. We can't hear you at all.
Okay. Voice is on full volume actually. So
Sir, we can actually hear. There is no.
Yeah.
It is actually very clear, and I guess even the volume is also fine.
It's okay with you?
Yeah, sir.
Yes, sir. Yes, sir. We are clear
Fine.
for
Take over.
we are,
Please start the session.
Yeah. We are clear. Okay. Good evening, everyone. Good evening, Dr. Isha Patel. And we have Dr. Isha Patel. My name is Dr. Mahesh from Department of Pharmacy Practice. We have assembled for the webinar on the topic coping with COVID-19. Dr. Isha Patel is an assistant professor from the Department of Pharmacy Practice, Administration and Research from Marshall University, West Virginia, USA. I, on behalf of principal, seniors, HODs, faculty members, students from KLE College of Pharmacy, Bangalore, and on behalf of Vice Chancellor, Vice Chancellor, and Register from KLE University of KLE Academy, University of Academic, Higher Education and Research, Belagavi, would like to welcome you, madam, to this webinar.
thank you.
Professor, Department of Pharmacy Practice, to introduce the speaker. Thank you, Ashwini. Now it is over to you. Thank you.
Sir.
Yeah, go ahead with the introduction.
Dr. Isha Patel. Yeah, sure. Thank you, sir. So Dr. Isha Patel has completed her Bachelor in Pharmacy from Pune University, India. She then went on to pursue her MS in Pharmacy Administration from Ohio State University located in Ohio, US, followed by her PhD in Social and Administration Sciences from University of Michigan at Ann Arbor, USA. She is currently an Assistant Professor of Pharmacy Practice, Administration and Research at Marshall University located in West Virginia. She has taught and currently teaches several courses in pharmacy curriculum, including Pharmacy Management 1, Curbing Medication Abuse, Bridging Health Research Outcomes, and Patient Care and Capstone. Dr. Patel has published 60 articles, Her research focuses on global health and epidemiology, especially on underserved and low-income population in India, Pakistan, Malaysia, Africa, and US. She has conducted several retrospective studies looking at racial health disparities in healthcare utilization for acute and chronic diseases, patient satisfaction, and healthcare services. She has also conducted KAP studies covering antibiotic resistance, pharmacovigilance, use of complementary and alternate medicines, medication errors, pharmacist satisfaction, and pharmacy workload. She has authored several editorials on drug safety and community pharmacy. Her recent research focuses on substance abuse management in underserved communities. In addition to research and teaching, Dr. Patel is an active member of International Society of Pharmacoeconomics and Outcomes Research. We welcome you to our session, ma'am. Over to you now.
Thank you so much. So it's good to talk to students in India. I would so Mr. Nusedur, I'm sorry if I'm not pronouncing it
No,
correctly.
no problem. No, senor.
I'm going to share my screen. Would that be fine now? So
Yeah,
that
yeah, sure,
yeah.
sure. Yeah, perfectly. It is perfect now. We can see also,
All
right?
Thank you. I think with Zoom, the call will get disconnected in about 40 minutes, right?
No, it's an
Yeah. But
unlimited
no, it
session.
is upgraded.
Okay,
Oh, no.
perfect. Thank you. I was just going to say that, please click on the same link to join again if, the session runs over, which it will after 40 minutes. So thank you so much. All right. So, okay. So today I want to speak about COVID, and so this is my attempt at comparing what India and US has done, and I'll try to provide an unbiased view of what each of the countries are doing. Okay, so I would try to focus on the positive and negative aspects of how India and US has coped with COVID. I will also, this entire lecture, I want to certainly focus on what is COVID and some of the hot button issues. And then we'll delve into what are the coping mechanisms that each of the country, or in other words, what are the successes and what are the failures of both India and US in managing COVID. So let me begin the lecture. Thank you very much for the introduction. And I would appreciate if we can keep the question and answer session at the very end. Let me please finish the lecture and note any questions you have, and I'll try to the best of my ability to answer them.
Yeah.
All right. So now, all right. So what is COVID-19? So now, this disease, was announced by WHO in February 11, 2020. Okay. And the official name, this virus, COVID-19 virus, it was the 2019 novel COVID outbreak. Okay. So, and it was first identified in Wuhan, China. Now, the name of this new virus is coronavirus 2019, and it is abbreviated as COVID-19. So the CO stands for corona, VI stands for virus, and D stands for disease. Okay. Now, the reason it's called as COVID-19 because the virus was it's a novel coronavirus. It was first discovered in 2019, okay, and not previously seen in humans, not this particular strain of coronavirus, okay. Now, what are the symptoms of COVID-19? So generally the symptoms, so as far as we know, the symptoms appear in 2 to 14 days after exposure to the virus, okay, in people. And what are some of the common symptoms? They can be fever, chills, cough, shortness of breath, fatigue, muscle and body aches, headache, loss of um, taste or smell, sore throat, nausea, vomiting, diarrhea. Just a minute, I'm adjusting my camera. Okay. Congestion, runny nose, and there are some severe symptoms as well, or serious symptoms as well. And here the CDC asks you to be on a lookout of these symptoms. And if you have any of the following symptoms, such as trouble breathing, or persistent pain or pressure in the chest, or confusion, inability to wake or stay awake, or bluish lips or face. Now, these symptoms are rarer and they are found in fewer of the people. And if people should be on the lookout of these symptoms, because if you have these symptoms, here in the US, CDC says you have to actually go to the emergency department. You should not wait to quarantine yourself at home. Okay. Now, we spoke about what is COVID. Okay, what is COVID and what are the symptoms? Now the transmission. So the virus that causes COVID is spread mainly through person to person, okay, through respiratory droplets produced when an infected person coughs or sneezes or talks, okay. Now, these droplets can land in the mouth or the noses of the people who are in the vicinity of the person that is infected, okay. And if a healthy person is in a vicinity of a COVID patient, these droplets can be inhaled into the lungs. Okay, so since the spread is more likely if you're in close contact, hence the 6 feet social distancing measure that's been, implemented by all the countries all over the world. Okay, now prevention. So for prevention, again, the prevention measures are pretty much same for all the countries. And the common preventive measures are washing your hands often with soap and water. It's recommended when you use sanitizer, you use 60% alcohol-based sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact if you have sick people in the home, and if you are outside, to practice social distancing, which is staying away 6 feet from other people. Okay. Covering your mouth and your mouth and nose with a cloth face, okay, when you're around others. So of course, there's a big shortage of face masks. US has been facing this shortage. It is still not really relatively that easy to get N95 masks. I hear in India, it is still that easy, but Amazon orders still take time. So, but relatively, I think in India, it's easier to procure those N95 masks. Again, cloth masks are more, they're considered to be better tolerated by people. And N95 masks, they have a snug fit and you have to make sure that they fit accurately. They're also difficult to breathe in. Always cover your coughs and sneezes, okay? Throw away any tissues that you are using when you have a cold. Immediately wash your hands with soap and water for 20 seconds, okay? Clean and disinfect your surfaces, okay, that you use regularly on a daily basis. If the surfaces are dirty, clean them more frequently. Use a household disinfectant. There is a list of EPA recommended disinfectants on the CDC. Also monitor your health daily. Be alert for symptoms, okay, so that you do not pass that on to your loved ones, your neighbors, or people in the community. All right, So now look at this, these two, on the left side, there's a graph, and on the right side, there's a bar chart. Okay, so on the left, the graph actually says, these are the cumulative number of samples tested for COVID-19 across India from April to July. Okay, and as you can see, in July, as of July 2020, India has tested about 14 million samples, which are 1.4 crore samples. Okay, now keep in mind, 1.4 crore is a very big number, but still think about our population. It's between 130 to 140 billion people, right? So it is about 1% of the entire population. Okay, so it's really very few samples have been tested. Now, the country went into lockdown on March 25th. It was the largest lockdown in the world because of our population, okay? And now we have red, orange, and green containment zones, okay? After we have come out of the lockdown. Now, on the right-hand side, you will see I have listed the top 5 states with the highest number of cases, okay? And these are the number of COVID cases across Indian states and union territories. So we have Delhi in there, and you can see that Maharashtra has the highest number of cases, okay? Which makes sense because of Bombay and how many people do commute to the city, and also many people from different states come to settle down in the city and for business purposes as well. All right. So moving on, the next bar graph is about testing, okay? So rate of COVID-19 tests performed in the most impacted countries as of July 27, 2020. All right, so you can see highest is UK with, 217,848 tests per, it's actually per million population, okay? So that is per 10 lakh people. So, and then look at where India is. So let me point out with my mouse here. India is, now again, I'm sorry, I had a long list of countries and this is what I could fit in the slide. So you can see India is nowhere in the top 5 or even in the top 10 or even in the top 15, okay? So we are barely doing, so see, most of the countries are, that are majorly affected by COVID, they're at least performing 29,000 tests per 10 lakh people. And here we are at half the capacity. We are pretty much at 12 to 13,000 tests per 10 lakh people, okay? Now, see, in March, WHO did recommend to all the countries to manage their COVID that you need to test, and test, okay? Any country that has done more tests, it was easier to track down the cases and control the spread, okay? So many countries did follow the advice. Countries that did not follow that advice very seriously, which included India, US, Brazil, see their numbers, they went up drastically compared to, let's say, Vietnam or South Korea, okay? So and now because of community transmission, we cannot do contact. It's very difficult to do contact tracing at all. Okay, so it's difficult to isolate the cases, and we did not catch the infection at an early stage. All right, now medications. So this is, of course, not a comprehensive list, but some of the medications that doctors or healthcare providers have been using to control COVID among patients. So first is the antiviral drugs. Okay, so remdesivir is a very popularly used drug, and many countries, healthcare providers in many countries are using it, including US and even in India, okay? Other antiviral drugs that people are also using are favipiravir and merimapodip, okay? And lopinavir and ritonavir did not prove to be as much effective, okay? Dexamethasone, this is a corticosteroid a type of anti-inflammatory drug, and it's used to prevent organ dysfunction or lung injury from inflammation. Okay, now keep in mind, dexamethasone is not for use in mild cases. Okay, so the US National Institute of Health has recommended healthcare providers to use this drug in only hospitalized COVID patients, which are the more severe patients. Okay. And it's being right now used in about 30% of people on ventilators and 20% of people who need supplemental oxygen. Now, the third type of therapy is the immune-based therapy. So this is convalescent plasma, use of convalescent plasma. So this is blood donated by people who have recovered from COVID-19. And again, it's being used to treat people that are seriously ill with COVID-19. Okay, there are certain drugs that are being studied with uncertain effectiveness. Okay, so some of these are antihypertensives, amlodipine, losartan, also antacids such as famotidine. Ivermectin has also been used. Okay, now again, it's not yet been known if these drugs are that effective against COVID or not. Okay, now all right, moving on to one of the drugs that created a lot of heat. Okay, for the pharma companies in India, also, pretty much the US president, threatened the Indian prime minister with some consequences if the drug was not to be supplied. Thankfully, I think India can produce up to 1 crore of anti-malarial medications every day. We have that capacity because of malaria being that rampant in the country. So we were able to send hydroxychloroquine to US. In fact, Jair Bolsonaro of Brazil, he actually told the prime minister, or he quoted hydroxychloroquine as Sanjeevani Booty and made references to Ramayana. Okay, again, this drug was, the hype was, it was a useless one. Hydroxychloroquine, as researchers found, was not that effective. Unfortunately, people still consume it in India, as well as they're consuming this medication in Brazil, and they're also consuming this medication in US. And this medication should not be taken because, first of all, it actually creates a severe shortage for people who need the medication, because many rheumatoid arthritis patients do use this medication. In US, in fact, when Trump made a big hoo-ha about this, about hydroxychloroquine, there was doctors actually started writing medications for their prescriptions for their relatives, and there was a very big concern among pharmacists because there was a concern for fake prescriptions. So it did create a shortage in US for patients with rheumatoid arthritis. Okay, so talking about a hot button issue. So now this issue was, it was a lot in news, and Cuomo, the governor of New York City, he made claims in the US that, we should be testing people with antibodies, and, if people have antibodies, then they can, resume the economy, because of course, the economy of all the countries has been affected in a major way because of COVID, and more so in India and US. So why are antibodies important? So it is to screen for possible immunity and to identify those people that have antibodies so that they can return to their workplace, contribute to the economy, or be assigned to high exposure areas. Okay. Now, on April 24, WHO, they made an announcement that they did not have enough evidence of about the effectiveness of antibody-mediated immunity to guarantee, accuracy of an immunity passport or providing people with a risk-free certificate. Okay. So now some of the questions that public health researchers or other researchers have been asking about this are, so if antibodies do confer immunity, for how long do they confer immunity? Okay, what about the accuracy of the antibody tests? What are the harms and benefits? Okay, if persons with no actual immunity, they're certified to return to the workplace. Okay, and how greater is the exposure, let's say, if people in the hopes of developing immunity to COVID, if they just join the workplace, let's say they're young and healthy and they feel that they will only suffer mild symptoms, so how great is the danger if they actually in the hopes of exposing themselves, to what extent would they develop this immunity? Okay, now see, in US, many people have been forced to return to workplaces, okay? Including myself. I'm going to my workplace every day. And now slowly, I think, schools in India will also open. I believe pharmacy schools, many schools will open in August. I'm not sure how many schools are, going to give online education. But the thing is, it is, at this stage, many states in the US have not performed antibody testing. Okay. And is this, is this policy better? Is sending people without antibody testing better than actually performing an antibody test and then sending people to the workplace better? Okay. So now there are a couple of factors that are into play. Okay. First is understanding the presence of COVID-19 antibodies in the population. So understanding the prevalence, okay? Basically, how much percentage of the people have developed antibodies, okay? So that they can be sent to the workplace. Another point is ability to correctly detect antibodies, okay? So basically, and also the ability to tell if the antibodies are absent. So the first case is sensitivity, the other case is specificity. Okay. Now, the third point is understanding the relationship about the amount of antibodies and the immunity that the person develops. Okay. And the fourth point is about two types of costs. Okay, so the first is false positive cost, which is the net harm of mistakenly releasing a susceptible or a potentially infectious person into the workforce with minimum mitigation. And the false negative cost is the net cost of failing to certify a truly immune person to rejoin the workforce. Okay, so these are some of the factors that need to be considered for antibody testing. Now, the thing is, we do have a lot of antibody tests in the market in the US. And, some of those tests are also giving inaccurate results. So FDA has been, posting a list of the tests that give inaccurate results. And, those tests are being pulled out of the tests have been recommended to be pulled out of the market. Okay. Now think about this. Okay, so of course, accurate antibody testing is very important, because see, if the tests are inaccurate and again, there's a risk of people joining the workforce and becoming sick, thinking that they're not going to get sick. So let's talk about HIV testing. Okay, so HIV antibody tests, they are about 99.5% specific. Okay, so basically, if you do not have HIV antibodies, 99.5% of the people out of 100, they will get that result. Okay, so soon, hopefully, we do have 100% specific COVID-19 tests. Okay, so hopefully in the future we'll have majority of the tests would be that specific for COVID-19 antibodies as well. Now look at this graph on the slide. Okay, so this is basically this chart. Okay, this chart represents the results of a study that were done at UCLA. Okay, so it's University of California at Los Angeles. So out of the 34 people, they were tested for antibodies. For 31 people, 2 measurements of antibodies were done. And for the remaining 3 people, 3 measures of antibodies were done. Okay, so the first testing was done at an average of 37 days after the onset of symptoms. Okay, and the age group was 18 to 65. And the second test was done at an average of 86 days, okay, after the onset of symptoms. So the range of the day, I'm sorry, the range, instead of age, I meant to say range, 18 to 65 days for the first testing with an average of 37 days. So 18 to 65 was the range of the days when the first testing was done. And for the second antibody test, the average was 86 days and the range of the test was 44 to 119 days. Now, if you see on the screen, you can see that by, between 90 to 120 days, the immunity does reduce, okay, for mild cases. And this is what, the opponents of antibody testing say. They say that, it is not long lasting in mild cases, and mild cases are what are in a majority, okay, for most of the countries. So most of the countries, the majority of the patients do have mild cases. So, the point, there is not much importance to do to perform antibody testing because it does reduce by within 120 days. Okay. Again, now this was, there have been these isolated studies. The UCLA researchers did follow a study done by Chinese researchers. So again, these numbers are very few. So more studies should be done, to actually find out if the antibodies last beyond 120 days. All right, now vaccine on the horizon. So everyone has been praying for a vaccine, okay? US, so basically let's talk about, there are 25 candidate vaccines in clinical evaluation, okay? And there are 139 candidate vaccines in preclinical evaluation. So for now, there are 4 vaccines that are in phase 3 clinical trials, including Moderna, okay, which is a vaccine that's being currently developed in the US. There is another vaccine which is in collaboration with AstraZeneca and University of Oxford. Also, I think, let's say, I think Johnson & Johnson has also begun its first phase 1 trial of the vaccine, okay? So the remaining 2 out of the 4 that are in phase 3 trials are 2 Chinese based vaccine companies, okay? So now about Moderna. So in phase 1 trials of Moderna, there were 45 people, and they found that after giving that vaccine, the number of antibodies increased up to 4 times compared to the number of antibodies that are developed in patients who have had COVID. So those were positive results. Also, right now you need 2 doses of Moderna. Now, depending if the amount of antibodies reduce over time, it's possible that, researchers think that you might need 3 doses. Also, it depends on how this virus is going to pan out. Some vaccine candidates might be more suited for vulnerable populations, like compromised immune populations or elderly populations. Now, the way Moderna acts is, there's a spike on coronavirus, right? So Moderna, attacks that spike. So that is how the virus invades the body. Okay, so by eliminating that spike, Moderna is aiming to diffuse the effect of the virus on the human body. Okay, so humans do not get affected. Now, okay, here US FDA, it has mentioned that for any COVID-19 vaccine to prevent illness or decrease the severity of the disease, it has to be effective in 50%, in at least 50% of the people. Okay, I feel the bar is not even that high. Okay, so to receive approval. Now the thing is, see, we have a number of vaccines, and it's a very good thing, because you should not be, the world should not be relying on one country for vaccine. Okay, so it's a great thing that vaccines are coming out now. Okay, about India. Okay, so about in-house vaccine production. Now, 6 Indian companies are developing vaccines for COVID-19. Okay, so the two, contenders that people are very hopeful from are Bharat Biotech and Zydus Cadila. Okay, so they're responsible for producing Covaxin and Zycov-D vaccine. All right. So I think, so for Covaxin, Bharat Biotech has joined with the National Institute of Virology, which is part of ICMR, which is the Indian Council of Medical Research. Okay. So, and I quote, Balram Bhargava did ask hospitals to fast track approvals of the vaccine and enroll patients quickly. Okay, for no later than July 7th, 2020, and also pretty much threatening the hospitals that non-compliance will be viewed very seriously. Okay, so, but now the thing is, okay, I understand it is important to get this vaccine out. Okay, so even getting this vaccine candidate, so basically Covaxin is in its phase 2 trials, and I think now Zycov-D will be entering in phase 2 trials. Okay, now this is not a small feat; it's a very big feat, because let's see that a probability of success of a vaccine in the preclinical stage is around 7%, rising to 15 to 20% for vaccines that reach clinical tests. Okay, this is not a small feat, but there have been a lot of concerns from public health officials and immunologists in India. Okay, so generally, public health officials are saying that it is absurd that we are going to produce a vaccine in 2 months. Okay, so even expedited phase 1 and phase 2 trials take a minimum of 5 months. Okay, and phase 3 trials will depend on a number of factors, such as subjects enrolled, decisions made by the Data Safety Monitoring Board, and that should take about 6 months. Okay, so that is 11 months. Okay, so one of the public health officials, and I'm not going to name names, but he was quoted saying, in his knowledge, such an accelerated development pathway has never ever been done for any kind of vaccine. Another person said that this seems very, very rushed. Okay, so public health officials are concerned that this is not, so I understand that, government is talking about releasing the vaccine by the 15th of August, and it's a pride point, announcing it on 15th of August, which is our Independence Day, but such a short deadline, okay, for a vaccine. And I honestly don't think it's going to be possible, because still, phase 2 trials are going on. So it's just a week away, and but it's not going to be feasible. But initially these talks were happening, and the thing is, public health officials in India, they were most of them, from what I read, they were saying that this is not about a race of getting somewhere first. It is about making sure that you do something right and make sure that whatever is launched in the market is safe for the people. Okay. All right. So ICMR, ICMR's actions should not lower the credibility of Indian science. Okay. The process should be done well. Okay, now, is reinfection possible? Okay, now this is another, so the first hot button issue was antibodies, the second is vaccine when it's coming in the market, the third is reinfection. Okay, so South Korea Center of Disease Control and Prevention, they did a study in which 285 people, they tested positive for COVID again, okay, 2 months after receiving their initial positive tests, okay. Now, the thing is, the good news was, they were not able to, or people that retested positive for the virus, they were not able to retransmit, they were not able to transmit that to the healthy population. Okay, so virus was not that strong, the strain was not that strong. The researchers are also, estimating that there are dead virus particles in the blood, which is why these people got a positive result. And they did not get as much of a sample. They were not able to grow samples in the lab, so that the virus amount was not that much in the people that got reinfected. Okay, so now one of the concerns is, what happens? What happens if you have this infection, or you have a COVID-19 virus infection and you do not develop antibodies? Okay, so then people do have their T cells and B cells that can fight reinfection. And see, if you survive the first time, the second time when your body gets it, you're able to fight it off better. Okay. Also, it is possible in some people that the virus lays dormant for a really long time and reemerges. Okay, so an occurrence that has been seen with certain viruses that result in lifetime immunity, such as chickenpox. Now, another possibility is that some people, they experience a long course of infection. Okay, that goes up to months after they first experience COVID-19 symptoms. Now, some patients, may also contract a different virus with symptoms that are similar to COVID-19. Okay, but scientists say that if there are two different versions of COVID-19's genetic code that are found in one person, then that is of a concern. Okay, so people have to be on the lookout, or doctors have to be on the lookout for that. Now, rolling back lockdown, another hot button issue. Okay, so we are going into lockdown, we are coming back again, going into lockdown, coming back. Okay, and this is happening in many countries. Now, as of June 1st, 2020, WHO has outlined 6 categories, okay, that governments have to track before rolling back their lockdown, okay? And India also has been, reporting on these measures. So now, the first 2 and the last 2, okay, these measures are right now being, they're being measured. The high vulnerability settings and the workplace safety, they're not being measured right now. Okay, so the first one is transmission control. So COVID-19 transmission should be controlled. So new cases should be reduced to a level that healthcare, that it does not exceed the healthcare capacity. okay? And that is one of the most important reasons most of the governments went into lockdown, okay? Or most of the governments enforced social distancing or strict social distancing, because it was about bending the curve, all right? So now this metric, this metric is measured from 0 to 1. Each of these metrics listed on the slides are measured from 0 to 1, okay? And the first metric is based on the number of new cases confirmed each day, all right? Then test, trace, isolate, all right? Now there should be sufficient public health workforce detecting and treating not only serious cases, but all the cases of COVID-19. Okay, so this metric is measured from 0 to 1, half based on testing and contact tracing policy, and half based on the number of tests per case per country. Okay, high vulnerability settings. So outbreak areas, controlling outbreaks in hotspots, controlling outbreaks in high vulnerability settings, minimizing them actually, and maximizing social distancing, minimizing the risks of newer outbreaks. Workplace safety settings, again, workplace safety, every organization, I believe this would be very difficult to measure as well, because every organization, though they are following, majority of the recommendations of the government, it's being implemented at a different rate and in a different manner. It would be really difficult to measure, I think, this parameter. Exporting and importing of cases. So managing the risk of exporting and importing cases from communities with high risks of transmission. So again, a metric of 0 to 1 has been assigned based on the stringency of the country's restrictions on travel arrivals. Okay, but this metric does not measure the amount of cases a country is sending to another country, okay? Because again, still flights, they have certainly started both in the US and in India. Now, communities, the last point is community understanding and behavior change, okay? So this is about to what extent a new normal, okay, new norm, the understanding of a new normal is for communities, okay? So basically, in a new normal is defined where, preventive measures are maintained. People realize that it is important to wear masks and maintain social distancing, not only to protect themselves or their loved ones, but their neighbors and people in community in general. Okay, so a metric from 0 to 1 also has been assigned, where the country has public information campaigns and the level of mobility reduction, and it is weighted for current transmission risk in each country. Now, see, if you see, now, of course, every country has reported on these 4 measures, okay? But I have just put 3 measures, which are, I've only put measures of 3 countries, okay? Because of the lack of space. So these are New Zealand, India, and US. So see, India is doing better, okay? So in terms of test, trace, isolate, we have 0.8, okay? For exporting and importing of cases, 0.8, and a 0.9 for community understanding. But look at this, 0 for transmission control. Okay, so see, one country which is again, it did very well was Jacinda Ardern's country, New Zealand. Okay, again, we are not New Zealand because people have been saying it's an island, easier to control. Agreed. Okay, and compared, and same is the case for US. Look at transmission control for US, 0. Okay, so we are between New Zealand and US. Okay, so overall, our overall metrics in terms of rolling back lockdown is on a scale of 0 to 1, it is 0.6, okay, as opposed to 1 for New Zealand and 0.5 to US. Okay, now, containment efforts. Are containment efforts a success? Okay, so now think about this. All right, in terms of, okay, whenever we do something positive, okay, we talk. So in India, whenever India does something positive, we say we are the world's fastest growing economy. Okay, we have this 5 trillion zillion dollar economy. Okay, and now when it comes to COVID, all of a sudden we should not become this country that is a poor country, okay, or a heavily populated country that is not being able to manage the disease condition. Okay, so it's important to contain this disease. Now again, I remember, I think it was a month or some time ago, where I know Narendra Modi praised Yogi Adityanath, okay, because there were only 600 cases at the time in Uttar Pradesh, and he said, look, Uttar Pradesh, the population is more than 4 European countries which have had 1.3 lakh COVID infections, and look at Uttar Pradesh, only 600 infections. But instead of doing that comparison, we need to say that, did we do better as South Korea or Vietnam? Or forget, South Korea or Vietnam, did we do better? Did other states, including Gujarat, Maharashtra, why are they not doing as better as Kerala? Okay, see, Kerala did very good in controlling, in managing COVID epidemic. Okay, UN also praised Kerala's efforts for containing the epidemic. So we do have in-house success story that we can follow for other states as well. All right. Now, again, when we had a lockdown, okay, it was a very good decision on part of the government, okay, though it was not implemented properly. We had this 21 days lockdown, and claims were made that we will defeat COVID, and it'll take 3 days more than the Mahabharata war. Okay, and what happened? Did we actually win the war against COVID? The infection is out of control. That was the suitable time in ramping up our health infrastructure and increasing our testing. I mean, I know that, there was a measure where, public health officials were recommending, and the government was recommending that people, that have been admitted in the hospitals with pneumonia, they should have been tested for COVID. And, certain states did it, but the implementation was not consistent overall. Then, again, I think in February, we were not, where other Southeast Asian countries were taking stringent measures. We were just, we were testing people for temperature at the airport. Okay, so we're just doing thermal screening for visitors from China. We're just not taking up any drastic measures. Okay. Now, lowest mortality. Okay, that is also claimed. We have lowest mortality in the world. Okay, one of the reasons, as provided by a famous public health researcher, Jayaprakash Mulyal, is that the average age of Indian population is less compared to other countries. Okay. Also, many of the people will, that die in the villages, they are not being tested. So you really do not know. You cannot at this stage, you cannot attribute if the deaths are taking because of COVID or because they are taking place of any other causes. Okay. Now, so timing of lockdown, okay. People were given only 4 hours of notice for lockdown. Okay. So that did not give many people. Now, again, it was important to, to put forth this lockdown, but 4-hour notice was not enough for people to adjust to their new lifestyle. People panicked. They rushed to the grocery stores. They rushed to the pharmacy, okay, to get their medications. So many people migrated. Okay, So the government failed to account for millions of people that lived in crowded slums, that shared toilets, that shared water taps, okay, that could not really socially distance themselves. Now, one positive thing that came out of COVID-19 is that it created awareness. Okay, so that was a good thing. Everyone in the villages also knew that the government was serious about this condition. Everyone knew that there was this new virus that was attacking the rest of the world. So it was a serious issue. Okay, but we did not in the 21 days. We certainly, we certainly had a lockdown, but we did not ramp up on our infrastructure. Okay, we failed to do that. Instead of, okay, now the way things work, okay, and we have been successful with this with HIV/AIDS, community interventions with HIV/AIDS. And this is true with even poor people everywhere, poor people tend not to believe in, place much faith in the government, okay, or they're distrustful of the government at times. That is why it is important to not use force on, certain classes of the population. That is why we need caseworkers. That is why we need community health workers. They serve as liaisons, okay, in communicating the importance of taking certain preventive measures to save save lives. Okay, so force was also used. So rather than persuasion, we did use police force as well. Okay, also, if everyone was not convinced, people were confused if it was a policy or if it was more of a guideline. Okay, so again, strictness of a policy does not necessarily mean that it is enforced. Now, enforcement of lockdown. We could not enforce lockdown on much of the population. Okay, about 20 lakh to 1 crore of 1 crore migrants were impacted because of this COVID-19. Okay, so the government did not consider that many people live on their daily wages. Okay, and this cannot simply be said that this is collateral damage. 1 crore people getting affected because of poverty, because of malnutrition, cannot be considered as a collateral damage of this pandemic control. It is any government's responsibility to provide social security to its poor. Okay, so we should not be blaming the migrants. That would be wrong. But now, unfortunately, because of this mismanagement of lockdown, enforcement of lockdown, many migrants ended up taking this COVID to their villages. Okay, where testing and healthcare infrastructure is really poor. Okay, so it's not the same as the big cities. Now, again, they were provided food, yes, and additional rations, but that did not take till 45 days, okay, after the lockdown. Now, under testing, okay, so we are still not catching up on testing. Okay, so in mid-March, when the curfew and the lockdown was imposed, only 6,500 samples were tested nationwide. Okay, by the daily testing capacity by mid-March was 1,400 samples. This for a country that has 1.3 billion population. Okay, now testing capacity has definitely increased. Over 1,000 laboratories now test. Okay, but again, for the country, the size of the country that is India, we need to do more. Okay, so as I mentioned, people are, most of the countries that are heavily impacted, we need to at least do 29,000 tests per 10 lakh people. Okay, we're still at half the capacity. Okay, and again, one thing, we did clap for our healthcare workers, a good thing. We did yoga, right? The government encouraged us to do yoga, to light a lamp. We did flower shower on, our healthcare workers. But did we work on the policy? Did we ramp on the health infrastructure? The answer is no. Okay, and again, I was reading about like some of the conditions of the hospitals in Delhi. Okay, that was very pitiful, and they were in really bad conditions. The patients were, were not treated properly. Okay, people were complaining so much. Now, contact tracing. We also gave up on contact tracing. Okay, see, Kerala had corona detectives. Again, we have a successful in-house example because I believe that Kerala was prepared to deal with corona because of their Nipah experience. Okay, and keep in mind the first cases of corona, they were students returning from Wuhan to Kerala. Okay, so India's failure to carry out contact tracing at a mass scale, that reflects poor state capacity. Okay, once there is community transmission, it is very difficult to do contact tracing. All right, now what are the US successes and failures? Okay, so a flattened curve, a somewhat flattened curve, because of stringent, majority of the states did have strict lockdown policy in the US, and because of which many states, they succeeded in stopping the exponential spread of the virus. Okay, there was also ventilator surplus, that was good. Our president was quoted as calling US the king of ventilators, and in majority of the Gerard Anderson, he is a public health professor at Johns Hopkins, and according to him, US did not, in his opinion, for most part, did not face a ventilator shortage anywhere. Okay. Hospital capacity, the successful examples are, we had the hospital ship Comfort come to New York, okay, sent by the president, because New York saw such a surge in cases a couple of months ago. Also, so for 2016's Hillary Clinton's election campaign, there was the Harvard Center, that was converted into 2,000 bed capacity, 2,000 bed medical facility. So that was good news as well. So hospital capacity has been fine, in many of the small cities in US as well. Okay. Vaccines and treatments, there are many candidates in the US for vaccinations. Many universities and many pharma companies are trying to successfully launch their vaccines. Okay, so now the question is, would we take up the first vaccine that comes up or wait for a good candidate? Okay, now there have been certain failures as well. Overhyped treatments. Okay, so hydroxychloroquine is a classic example. Okay, people have been quoted to saying that this is what happens when there is an emergency situation and a push for something that is not effective. That can be really dangerous, and that's what our president did by proposing hydroxychloroquine tablets. President was also said using disinfectants and UV rays, to kill the COVID inside inside humans. Okay, and he was heavily criticized for that, because when he made this announcement at many places across the country in the US, the poison hotline numbers, the number of calls went up drastically. Lack of PPE. You can see a cartoon on the slide. We did have for months, there was a big PPE shortage. Okay, people used makeshift masks, from scarves, from coffee filters as well. I was reading about a pizza place. They used their hot furnace to make PPE, and they delivered that PPE in pizza boxes to the hospitals. So that was very interesting, but it's also very sad, right? A Washington Post. So there was a project Airbridge where about I think an air shipment of protective supplies was going to be, the government was going to import it from overseas manufacturers, okay? And this actually had more than 10 lakh items. And investigation done by Washington Post shows that, we're not able to track it now. So there's little evidence of where these supplies have ended up. Testing shortcomings. So again, Trump stood in the Rose Garden saying that America is leading the world on testing. We have, met the moment and we have prevailed. And that was over-promising on testing. Okay, so on March 10th, Vice President Pence promised that US would hit 40 lakh tests per week. Okay, and that was not achieved till the end of April. So, then Mike Pence did say that I was talking about the tests being distributed but not processed. All right. Inefficiency in economic aid. We did pass a very big budget for COVID, okay? $3 trillion. Now this included hundreds of billions of dollars, okay, for low interest loans to businesses that would not, lay off workers, or for people that lost employment, or just helping people with, their COVID or healthcare related costs in general. Okay, but the way the money was distributed and how this, the pan out of economic aid did not take properly. Now, Indian government's response. Okay, now these updates are between 1st to 15th of July, the announcements that were made by the government. Okay, so school closing. So school closing has been extended till the 31st of July in both containment and non-containment zones. Workplace closing. India has allowed businesses in non-containment zones to reopen on July 1st. With official recommendations for work from home and how the work hours are being staggered, and only essential services again continue in containment zones. There is cancellation for any social, religious, entertainment, academic and cultural events from July 1st in both containment and non-containment zones. There's been a restriction on gatherings, okay, on July 1st, so no more than 50 guests, in weddings, and no more than 20 people in funerals. We did have this big Ram Mandir opening, and it was shocking to see. And I'm guessing that Uttar Pradesh will see now a high surge in cases. So again, I know religious sentiments are very important to people all across the world, not only in India, but this kind of gathering, and again, of course, people, got some employment because of the construction of the temple, but was this gathering really important at the time of the pandemic? Okay, it really speaks about the priorities of the government, okay, and the inability to control crowds. Closing public transportation. India resumed domestic flights and passenger trains on July 1st. Metro rail systems still remain closed. Stay-at-home requirements. Okay, so India has imposed a nightly curfew on July 1st, and daytime movements to be restricted in containment zones, okay, except for essential services. Restriction on internal movement. So again, a strict perimeter control in containment zones has been placed as of July 1st, barring movement in and out of designated areas. So for example, I'm sure it's in other cities as well, in Bombay, like, there are checkpoints at every 2 kilometers. So that is very good. Again, the question is, they're enforced or not. International travel controls. India has extended its ban on all international flights on July 1st, with the exception of repatriation flights. Okay, now future COVID-19 management recommendations. Okay, so increasing testing capacity. So government should increase the capacity of the test sites and increase the number of laboratories that perform these tests. Okay, now see, we have a very good example of in-house success in manufacturing of PPE. Okay, so similarly, we need to increase our testing capacity. Assisting poor workers. So in 2017, the Ministry of Housing and Urban Poverty Alleviation, they had certain provisions such as affordable housing or emergency employment schemes or access to social entitlements and service provisions. These need to be made use to, help out or assist people that are affected, the poor migrants or poor people that are affected by COVID. Okay, India did announce some time ago that it's going to be essential supplies worth 800 million for 800 million would be made available, and that is a good step. It's a step in the right direction. Maintaining regular health services. So it is important to maintain essential critical health services so that there is not a resurge in, vaccine preventable diseases or chronic disease conditions. So see, during, in the month of February and March, between 1 to 2 lakh kids they missed out their routine vaccination. Even treatment for TB showed declines in this time. So it is important that other healthcare services are not disrupted. Okay, because see, we are now, we also have malaria season. So, we have to make sure that in order to control COVID cases, we should not let malaria cases surge. Enforce emergency measures. Okay, so there should be social distancing should be enforced, quarantine should be enforced. People should be mandatory, should be made to wear masks in a mandatory manner. Hand hygiene habits should be followed. Okay, there should be improved detection and containment and mitigation of the cases. Okay, acceptance of community transmission. Okay, so again, virus spread in the community is not government's fault. Especially, see, we have people, asymptomatic patients also contributing to the spread of the virus. So that is how the virus was going to spread in the country. Okay, so the government, some time ago when it did its first Sero survey, estimated that 0.73% people in India, which was about 50 lakh people, they did have antibodies, and now the number has certainly gone up. Okay, so, it is really difficult to control the spread of virus in densely populated countries, and that is the case with India. So rather than being in denial, the government has to accept that, okay, and people also have to accept that the virus has spread and we have to deal with it. Reduce caseload in hotspots. Okay, now many cities, okay, they were quarantining people that were returning to their cities in public facilities and hotels. Okay, one of the reasons that people also did not want to leave their homes was because the government quarantine facilities were dirty, okay, and unhygienic, and that is why people in the slums did not want to go to those facilities. Now, it is rather than, because this is very, it is time consuming, it is labor intensive to quarantine people in public facilities and hotels. So rather than, it is better to quarantine people at home. Okay. Again, Jaiprakash Mulye, who is a public health researcher in India, he has recommended that that the government can instead of putting money in quarantine people, this money can be put into oxygen procurement and into hospitals so that patients are treated properly in the hospitals also, and it is cost effective. And there can be reverse quarantines. What is reverse quarantine? That old people or vulnerable people can be quarantined from healthy adults at home. Okay, so okay. So this was it. That was the presentation, and now I will take any questions.
Now it's time for question and answer section. So if anybody is having any question, means just unmute yourself and ask. Anybody is having question? Any question?
Dear students, any questions you have for to understand on the US part, right?
I'm sorry, I know the presentation was about almost 2 hours, but
No,
I hope
it was indeed a good explanation, and it was in depth, and we could able to understand the experience on both the sides. That was good. That's good. But maybe they may take some time to check out the questions to ask.
I think Ramshad has raised the hand.
Oh, good. Yeah, please go ahead.
Okay, unmute yourself, Ramshad.
Good evening, ma'am. Myself, Ramshad. I have just completed Doctor of Pharmacy, ma'am, at Kelly College of Pharmacy. Ma'am, can I ask you a question related to treatment? Is it okay with you?
sure. Actually, if I'm not able to answer, I'll be happy to let Dr. Dang know via WhatsApp.
Sure. Thank you, ma'am. Ma'am, my question was, as you said, the remdesivir must be used only for the hospitalized patient, right? Is it
No.
because of lack of supply or?
No, I was talking about the corticosteroid, dexamethasone.
How about the remdesivir, ma'am?
I'm not really sure. I think patients are using it. I'm not really, so I did not find about that. I did not find accounts about that it's only being used for hospitalized patients.
So is it okay to use remdesivir even in a non-hospitalized patient?
So actually, I'm not, I would just say that I have just read about accounts being used. I mean, as far as I know, yes. But again, it was an isolate, there were only few tidbits of information that I have seen. So I think people are using it for people are using it for for non-hospitalized patients, as far as I know. But the corticosteroid that I was talking about, that is for hospital use only. That should not be used without surveillance of a physician, because that is only for patients on supplemental oxygen or for patients on ventilators. I think remdesivir was also used for, if I'm not wrong, I think it was used for Ebola as well.
Yes, ma'am. Yes, ma'am.
Yeah, I think, in the 2-3 months ago, actually, it was APHA, I think American Pharmacists Association, or I did read a very good account. I was going through one of the papers for all the possible, for all the possible medications. And, this was even before President Trump made a big deal out of hydroxychloroquine. Among the research community, this was actually considered to be a really promising drug. Though, now there are more accounts of its use in public domains, but, this was actually being used or considered a useful treatment.
Thank you, ma'am. Thank you so much, ma'am. I have one more question, ma'am. Shall I proceed with that?
Yes, please.
Thank you so much, ma'am. Ma'am, how about the corticosteroid? What are the recommendations for the corticosteroid for the patient with COVID-19 who are on supplemental oxygen but who don't require high flow oxygen?
Who don't require, say it again? High flow of oxygen. So for now,
the patient who require only supplemental oxygen but who do not require high flow oxygen, can we give steroid to that patient?
Yeah, so actually, corticosteroids, they are, so dexamethasone is only recommended right now. It's only recommended for patients in hospital on ventilators. So basically, see here in the US, when you go and, all of this goes hand in hand. So when you are, most probably patients are, they are in ICU, and they are being given oxygen, and they are on ventilators. So the thing is, as far as I know, this is only for critical patients. Again, if you are on a ventilator, you are a critical patient. Or if you are
Yeah,
needing
ma'am.
any sort of external oxygen, you are in a critical condition because you are not able to breathe.
Thank you, ma'am. That's all. Thank you, ma'am.
All right.
Any more questions?
Dr. Patel, I would like to understand how pharmacy practice professionals in US are getting utilized in this COVID circumstances.
So, okay, based on, so basically, again, I have seen certain changes. So pretty much, in terms of practice, again, the social distancing measures are enforced. We have also seen more and more patients picking up medications, doing curbside medication pickup as well. And also, like, okay, before there were patients that would line up in the pharmacy. We do have, 6 feet social distancing. Everyone is wearing a mask. Efforts have been made to the best of the abilities of the institutions or organizations or the pharmacies to provide N95 masks. But again, it's really difficult. I've seen some of my students post pictures on Facebook. It does leave, scars on their face. It's really, it's very uncomfortable, but they have been using some sort of protection, certainly, and patients have also been taking this seriously. Again, in US, you can also get 90-day supply, which is a mail-in supply, and there's a surge in that as well. You have to also understand that every insurance company is unique, and they partner with certain pharmacies or certain companies. So, but all in all, many companies are seeing a surge, for mail-in pharmacy prescriptions, for curbside pickup, especially the older people. In terms of academic settings, I feel, so, okay, again, that goes without saying, pharmacists have been overworked because of, medication demands and supply. Okay, that is also there. Many people they have been picking up extra shifts as well. So that is in terms of workforce as well. In terms of academic settings, we do, like, I know KLE is also enforcing social distancing, and I know Dr. Dang posted a good amount of pictures on Facebook. We actually, I did speak to you on WhatsApp about that. So that's a very good measure that KLE is taking. In my university, personally, we do have like arrows pasted in the corridors, and we have directions where you enter and exit. We don't use the same doors for entry and exit. Also, like restrooms, we do not have more than 2 people in the restrooms or in the elevators. Even in our lunchroom, we don't have more than 2 people. I don't know about India, but in US, every faculty has their separate office. So if we keep the doors open, we do have an open door policy, because if we keep a door open, then we have to wear masks. If we do not keep the door open, then in our office, we don't have to wear a mask. But every time I go outside, I do wear a mask. We recently also had a retreat I was not well, so I could not attend it. But we have about 60, 70 people. We in that faculty retreat, we divided them among 3 big rooms. So we had 6 feet distance among people. But again, let me tell you, regardless of what my university is doing, the best option is social distancing and going online. I feel Harvard, MIT, many universities did go online. My husband's university, which is Ohio University, also went online. For most of the faculty, for most of the courses. So that is very, very good, because the thing is, people are, in his university. So the thing is, you cannot, okay, when people, like say people that they're not local, right? And that is the story of more than 50% students in the US. If you think students are going to come back to campus and not party, that is an unreasonable expectation. Everyone wants to drink alcohol, party, not wear masks, have fun. So, there was my husband's university became a hotspot, and then they had to they actually had to adopt more online teaching after that. My university has not done that because our governor, has opened the state for business, and our university is against going online. But I feel the best option is going online because it's very, we didn't even get tested. Now we are going to get tested, but how frequently are you going to test people? And again, the thing is, if you are asymptomatic, okay, um, and what if you pass it to other people? Like, do you want that? Or that is a point of anxiety for many people. I feel very scared going to my office every day, and I try to minimize my interaction with people because my husband is at home and I don't want to spread the disease to him. So that is certainly of concern. And the thing is, who is going to be responsible if your lung capacity decreases by 20-30%, which has been seen in patients in Hong Kong? Who's going to be responsible for that? So or I just a couple of days ago in JAMA Cardiology, a study came out, and it was out of 100 patients, 78 patients who prior had some sort of cardiovascular problems. Again, cholesterol is common in so many people. It is not about being fat. Even thin people can have high cholesterol. It's very common even in India. Very, very common because of obesity even in US, right? So many people did face cardiovascular damage for months on after they got COVID. So who's going to be responsible for that? Because as of now, we really don't know if the effects that they linger for how much time, and what is the long-term damage. So can you afford, because you gave COVID to your old granny, can you afford your granny to not walk without without shortness of breath for the rest of her life? That's the question. So I feel like we are doing this webinar online, and I believe that I know the big struggle here is and this is also for pharmacy schools or for academic community. The big struggle is most of the money that comes for the universities, that comes from residence halls, that comes from the food courts. Okay, so that's a major revenue source for universities in the US, and if they change to online module, it hampers their revenue. So that is a very big issue. But the thing is, I mean, we have done a survey, and some of our students are very, very scared to come back, whereas some of them don't care. But this is very, very serious. It doesn't matter. It doesn't matter if you don't have the symptoms. We just don't know what are the long-term repercussions. And we just cannot be fearless about it, or we cannot just say, we cannot have a fatalistic attitude saying, okay, it's in God's hand, whatever happens. No, you can protect yourself. Just like you can protect yourself against HIV, you can protect yourself against COVID-19. It's not rocket science. We know how to protect ourselves. So I feel, online education is cheaper. I understand that. But again, in-person education, there's certainly a difference
Yeah.
when you go, in the room. So, I believe that there is certainly a difference in schools that have been teaching online programs versus schools that have been doing in-person teaching. So even those people that are doing in-person teaching, if they do online teaching, I don't think the quality would be hampered. And I think that it would be avoidance of anxiety for many faculty who want to protect their kids, who want to protect their spouses, their parents, as well as, many of my students do have children, because pharmacy is not the first, it's not their first profession, out of high school. And in US, many people do undergrad, which is, a bachelor's degree, and then end up doing PharmD. So many of my students, they are 30, 35. My oldest student
Oh.
actually this year is going to be 65.
Oh, amazing.
So, it's just,
Yeah.
it's really, I don't think people are taking it seriously in India and
Oh,
US.
okay.
And another thing is, I feel like as healthcare professionals, I think, again, creating awareness is very, very important. And, social distancing to the best of our ability is important. I understand certain people on administrative positions cannot work from home, like presidents of universities, deans of schools, like Dr. Dang, might not be able to sit at home and run the college. I understand that.
Yeah.
But, whenever, the thing is, a couple of months ago, there was a post, or there was a newspaper article, and a public health researcher here, I think in Jefferson University in Pennsylvania, he came up with 4 models. And one of the best models was, so even that strict lockdown was not a very good model that China and India implemented, but one of the best models for controlling the virus was letting less people out in the community. So like 1 in 8 people, that would slow down the spread of the virus and people would recover more quickly.
Oh,
And unfortunately, India or US is not doing that. So yeah, please, I would urge everyone in India, people don't even know the person next to them has COVID or not. It's spreading at that rate. And underreporting is so common with so many infectious diseases in India. So you really have to be careful. This is a very, very serious condition.
Yeah. Thank you. Yeah. Rahul, Dr. Rahul,
Yeah.
can we go for other questions?
Anybody is having any more questions?
Rahul, I want to thank Isha.
Okay. Sure, sir.
Isha, thanks for coming on our forum of KLE. Wonderful session, I should say. The type of depth you have gone in and the more information you have than us about the Indian states and the Indian conditions, fabulous. My students might be really entitled. Very good. Thank you, madam. So I think we can conclude the session.
No, sir. Dr. Rini is waiting to give her vote of thanks to Dr. Patel. So I would request Dr. Rini, please go ahead with your vote of thanks. And
thank you, sir. I would like to thank Dr. Isha Patel on behalf of KLE College of Pharmacy, and I further extend our gratitude to our Vice Chancellor, Chancellor, Principal, and Vice Principal for supporting and encouraging the organization of such a webinar. And I thank all the coordinators as well. And lastly, I thank all the participants for having spent your time to attend the webinar. Especially thanks a lot, ma'am, for spending such a long time for elaborately explaining on how it happens in US and also in India and how we are fighting this particular pandemic. Thank you, ma'am.
I'm glad. Thank you. And if you have any questions, feel free to pass it on to Dr. Dang, and I'll be happy to answer the questions.
Yeah. Sure,
Thank you.
Sure.
So nice of you. What's the time in US now? I think it may be early morning.
Yeah, it was the lecture was at 7:30.
Oh, great.
So that's fine. It's about 9-10 a.m. in the morning. It's Saturday morning. So
Saturday morning, yeah.
Have a fabulous weekend. Take care.
You too. Thank you.
Take care, madam. Yeah, thank you. Bye.
God bless.